Welcome to the Community Pharmacy More Profit Roundtable. This is the mini version that I do weekly at 4:30 Eastern Time, 1:30 Pacific. And we get together to help community pharmacies find ways to bypass the PBMs and make more profit. So my name is Breck Rice. I'll be your host this afternoon. Also have the Vice President of Sales and Marketing from Remote Care Today, George Veronis, listening in. He'll have some comments as well. He'll keep me straight on their program because it's an amazing opportunity for community pharmacies. So that's the Remote Care Today program. But I help community pharmacies for over 20 years now. I'm a big advocate to help community pharmacies. One of the things that I do is the PBM Reform podcast on the Pharmacy Podcast Network. Everything that I talk about is going to be, bypassing the community pharmacies. I'm the co-founder of ServeRx. ServeRx is a third-party payer specifically for community pharmacies to process their workers' compensation claims. So when a retail patient comes in, they don't have any proper documentation. You can send that to our bin and PCN and get the fair reimbursement you deserve. We are out of network with the PBMs, so we are bypassing the PBMs as well with ServeRx. That way we can get you those higher reimbursements. They're typically triple or quadruple the reimbursement that you would get from a PBM. So medication like meloxicam, most PBMs are only paying $4 and $5 for a month's supply. You should be receiving well over $90 for that one medication. That's what ServeRx would pay you for that. So again, everything I do bypasses the PBMs. Now, I know that that's a long process to make reform in, and you're never going to completely get away from the mafia of insurances and PBMs. And so that's why I've hosted this other podcast series called the Community Pharmacy More Profit Roundtable. And that's why George Veronis reached out to me, because he had this amazing opportunity to help community pharmacies better help their patients, and knew about my podcast series, knew about my connection with community pharmacies. And so that's why I've volunteered to help educate community pharmacies about the remote therapeutic monitoring program. This is a new program, first time that it's ever been offered through community pharmacies. It is part of the home care solutions that Medicare covers. The chronic care management, or our CCM, was the first CPT code to be covered by Medicare, clear back in 2015, followed by remote physiological monitoring, or remote patient monitoring, RPM, came onto the scene in around 2019. And then just a couple of years ago, the new kid on the block was added, and that's the remote therapeutic monitoring. Now, CCM and RPM were really focused on providers, so doctors prescribing that to their patients, where RTM doesn't require that primary care provider to prescribe it. And so this is why we're able to make this program available through community pharmacies. Now, you can expand your scope of services into doing CCM and RPM. There are a couple of extra steps. So you can get involved in those other remote care programs. But again, you need the collaborating provider, a CPA in place. You need to be in the network to do the billing and all of that. And so because so many community pharmacies are interested in doing more clinical services, we have outlined a 3-step process to do that. But today we are going to just focus on the really the first step mainly, because there is no startup cost to the pharmacy whatsoever to do step 1. You'll never be asked for an implementation fee. Even the patient education materials, everything, all the marketing materials are provided to your pharmacy free of charge. Those will never be a cost to do the remote therapeutic monitoring. But our TM program does have a relationship with IPPN, which is step 2. It is the IPPN providers. They have over 5,000 doctors in their network. Those are the doctors who will be qualifying the patients for the remote therapeutic monitoring program. And then also the IPPN hub will be the billing platform that Remote Care Today uses. in order to do the billing and collections for the services on RTM. So just want to outline the three steps here because there are more wrong ways to do this than right ways, and we want to make sure that you're navigating the correct way to do clinical services at your community pharmacy. So step 2 and step 3 are not at all necessary. They're mandatory. But if you want to expand your scope of services, you certainly can expand into those areas. And we do want to just highlight some of the benefits. You can do step 1 completely independent. Never take step 2 and step 3. You just can't do step 3, which is the full brick and mortar clinical room, without step 2. It does require being in network with IPPN in order to have the full brick and mortar clinical room. So to focus just for the next few minutes on remote therapeutic monitoring, or RTM. Again, remember, this is step 1. This is the program that doesn't have any startup costs for the pharmacy. It is covering these conditions, mainly the musculoskeletal disorders, but also respiratory issues and medication management. In the center column, you can see the symptoms that are covered. This is a very broad range of symptoms: pain, stiffness, weakness, swelling. It's very easy to qualify a patient based on their symptoms. And then the outcomes are absolutely amazing. It is addressing the two top concerns that seniors have: loss of memory and a loss of balance. Now, it covers a whole lot of other beneficial outcomes too, but those are the main ones that seniors are concerned about. Helping seniors stay independent longer, keep their driver's licenses and live independent a lot longer when they're involved in remote therapeutic monitoring. Medicare is interested in covering this program because the leading cause of injury-related death in seniors are falls. They're spending already over $50 billion with a B, in addressing falls today, and they're projecting that is going to double in the next 5 years. Cognitive impairment is a significant contributor to falls. I was just talking to a community pharmacist in North Carolina just last week. His own brother-in-law has dementia really bad. He fell down and unfortunately broke his hip. Well, they repaired the hip, did the hip replacement, but he's had 4 or 5 falls since because he forgets that he had a hip replacement. So he gets up in the middle of the night to go use the restroom and doesn't use his walker, and he's falling down again. It's a really sad situation. In fact, there's research now that shows that a senior falls down every second of every day. Seniors in their 70s and 80s, 2/3 of them are experiencing some kind of cognitive decline, and now about every minute, someone is diagnosed with Alzheimer's disease. This program that we're sharing with you today has been clinically proven to delay or even prevent dementia by 5 to 8 years. For someone in their 70s or 80s, that's like a lifetime to them to be able to prevent or completely delay any cognitive decline. So I have a 2-minute video that explains the Brain Health Plus platform better than I can explain it. It's very comprehensive. So let me just share this 2-minute video with you.
As an independent pharmacist, you already know your patients count on you. And with reimbursement challenges and tight margins, finding new revenue streams that actually help your patients is more important than ever. That's why we're happy to introduce you to Brain Health Plus, a remote therapeutic monitoring program, RTM, covered by Medicare Part B and most Medicare Advantage plans, designed to improve memory, balance, and cognitive function in just 5 to 10 minutes a day. It does this with fun exercises and games that stimulate the brain, increasing neuroplasticity. Your patients can access Brain Health Plus from their smartphone, tablet, or computer. It's a one-of-a-kind RTM platform that offers engaging, fun, and clinically proven activities to improve cognitive health, prevent falls, and helps your senior patients stay independent longer. We're talking about daily brain games, interactive motion sensing exercises, motivational health content, medication management tools like being able to scan your medicines right into the system, reminders of when to take medicines, potential drug-to-drug interactions, and even geofencing alerts, so loved ones are notified if a patient visits the ER or hospital. Every patient also gets a 30-second biometric facial scan they can do at home so they can scan their face and track their health as often as they wish. This amazing technology lets them track important health vitals like blood pressure, heart rate, and oxygen levels with 96% accuracy. Done with a smartphone or even a computer, it keeps patients motivated and engaged without replacing their medical care. And here's the best part, we do it all for you. You get a fully turnkey solution: flyers, posters, bag stuffers, and patient onboarding handled entirely by us. We even do all the Medicare billing. No added staff time, no upfront cost. In fact, no cost to you ever. Just real results for your patients, such as a clinically proven decrease in falls and better memory. And you can earn administrative service fees for simply reviewing monthly patient progress reports for each participating patient, which will significantly add additional profits to your bottom line. Brain Health Plus, easy for you, powerful for your patients, and great for your pharmacy.
So as you can see, very comprehensive program. Couple of points that I love about it is the reminders for taking medications. That's so important. And then the geofencing, those alerts are amazing for, someone that ends up having to go to the emergency room or the hospital. Their family members are immediately notified without even a phone call. And that bioscanner, to get your biometrics for your blood pressure, heart rate, oxygen level. That is some amazing technology. I've played around with it before. It's very accurate. It's kind of like James Bond kind of technology, but an amazing tool. The pharmacy will have access to that too as well, right, George? Because it's not just the patients that'll have it. I think the pharmacies will have access to that.
Yeah,
So
they're
that
going to have access to the program and this to be able to use and try it with themselves.
Yeah, perfect. That way you can use that as a patient engagement tool. And it is covered by Medicare Part B. Don't stress if you're not in network with Part B. We know that your pharmacy is probably in network on the Part D side. D is in David, but the Part B, B is in boy, is on the medical side. No worries because Remote Care Today is in network and they're billing on their NPI. So covered by Medicare Part B and most Advantage plans. And I want to share one testimonial with you. This is my favorite one. I'm based out in Phoenix, Arizona, and Paul's just south of me down in Tucson. Paul is 89 years old, and he admits that he doesn't like to exercise. So even though he doesn't like to exercise at 89, he'll still do this Ludafit program because it's fun. And Ludafit is just one of the tools that is in the Brain Health Plus platform. But let's hear what Paul has to say about this.
My name is Paul Charney. I live in Tucson, Arizona. I just turned 89 years old, and I hate to exercise. When I had the opportunity to try Ludafit, I found it fun. I enjoy it. I enjoy it because it's a game, and psychologically, I know that it's benefiting me. You move, and the avatar, that is the figure that represents you on the screen, it moves along with you. And it's fun. You hear the shushing of the skis through the snow, and you see obstacles in front of you. You try to avoid the obstacles. And my very favorite, even though it's probably the most strenuous, is the Thai rock climb. What you're doing is climbing up a mountain path, and not only are you sidestepping, but along the path, there are rope ladders. And in order to climb a ladder, you reach your arms up and you just keep moving. My kids saw me exercising and they wanted to try it. And they were laughing, and it comes with a lot of giggles anyway. Initially, when I first started it, I had to hold on to a chair. But I found that repeatedly doing the exercise, I got confidence in letting go of the chair. So right now I do it freestanding. Bottom line, I'm sold on it.
Yeah, I love that Paul talks about avoiding the obstacles as he skis right through a boulder. But the main point I want to make on Paul's testimonial is that when he first started the program, he needed to stabilize himself by holding on to a chair or a walker or something. Well, now after doing it, he's completely freestanding. He's doing the movements on his own, and it's improving his balance considerably. So it does have the benefit of reversing muscle atrophy, along with so many other things. Again, my favorite statistic on the cognitive, plasticity is that patients that are involved in this program are 75% less likely to contract dementia. That's a tremendous statistic. Now, all of the patient education information, the posters, flyers, bag stuffers, in fact, George's company is even printing on the bags themselves. So you'll have the customized uh, uh, prescription bags that are provided for you, all free of charge. There's never any cost. They'll set up a landing page for you. So this landing page is like your own website for the program, and you just simply direct patients to that landing page to get additional information. It's great to have someone who's the face of the pharmacy do a little welcome. So if it's you as the pharmacist, or if it's one of your technicians that everybody knows and loves, have them do the little intro. And Remote Care Today will help you draft that, the little script for that intro. That way they see a recognizable face when they go to the landing page. If you are using SMS texting for refill reminders, or it's time to get your flu shot, I actually just got a reminder today from my community pharmacy that it's already time to get my flu vaccine. If you, whatever that system is that you're doing with patient education, that will be the same system that Remote Care Today will use to do any patient education and outreach. In fact, if a friendly phone call is made, it can be made so that the patient sees on the caller ID that it's your pharmacy that is reaching out to them. So whatever the tools are that are being used to contact your patients, that's what can be used in engaging with the patients on this program. Now, this 30-second video here will show you what the pharmacy's responsibility is and what they need your assistance with. So they need assessments done. This is kind of a checks and balances. You're checking to make sure that the patients are continuing to have progress, and then making any notes that would notify their care coach if any adjustments need to be made. So this 30-second video will show you what your responsibility is.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
So it shouldn't take you more than a minute per patient to do those reviews. And so again, just the simple process here is that all the marketing materials that patient education is provided for you. Your patients click the enroll, and then an onboarding person will visit with them to go through insurance verification. Probably 80-85% of your senior patients that qualify won't even have a copay because they're either dual enrolled or they have a supplement plan. For that 15 or 20% that do have a small copay, they'll know that up front. So there's never any surprises. What you get compensated for your reviews is $25 per patient per month. That is a residual month after month. And so in this example, 100 patients should take you less than 2 hours worth of reviews. So not a bad return on your time investment at $1,250 per hour. So the next steps here for this program are outlined here in this short little explainer video.
To get started, your next steps are easy. First, complete our agreement and sign the BAA, which ensures HIPAA compliance, and then we'll schedule your onboarding meeting. During this meeting, we'll show you what we mean by a turnkey solution. We'll discuss how we engage patients and the materials we can print and provide you that help patients engage with us. We will then educate and onboard your patients using approved text messages, emails, and friendly phone calls, providing the patient the appropriate programs and coaching, all without any cost to you. And don't forget, you can earn monthly administrative service fees by reviewing your patient's progress. It's about better care for your patients, more profit for your pharmacy, all with a zero out-of-pocket investment. Let's get started.
So it really is a no-brainer for community pharmacies to provide this service to your patients. And it's not just for Medicare. That's just the easiest patient population to identify because 95% will qualify. But even commercial payers will cover this program if there is a need. So there's got to be medical necessity. And so commercial payers will cover it if a patient isn't on Medicare, but they have they're recovering from an accident or an injury, or even, a traumatic brain injury or something like that, they would qualify. But it's a case by case. So I would encourage all of our community pharmacies to get with the care consultant that invited you to this demo today. And get your paperwork filled out and get in the queue to get onboarded. The first pharmacies are in the queue to get on board. There's more than 300 now, I believe, George, that are getting ready to get set up, and the first of them will get set up here in the next week or so. So it is brand new to community pharmacy to be able to offer this to your patients. George, did you have anything else that you wanted to add or something that I've missed?
Well, the most important thing I'm just going to reemphasize is that the beauty of this program is Medicare wants doctors and pharmacists and patients to use this program or use programs like this for cognitive and falling and all that, as you saw earlier. So it's a win for the patient first and foremost that we care about. It's a win for the doctors, and it's a win for everybody promoting it because it's some program that's not a cost to anybody, as Breck said throughout this, and that's the beauty of it. So it's really just introducing it, getting it out there, getting patients on it. They'll live a better golden years of lives, and you'll benefit also from seeing your patients get better and also get paid to do the administrative fee. So it's a great program. Like we said, we probably talked to 350 pharmacies, and I think 345 signed up so far to get in queue to do the program because of the way it's set up. So we look forward to working with everybody and having a great experience. And Breck, thanks for doing this. A lot of good information.
Yeah, well, thank you, George. And so I'll cover really the next step 2, which is IPPN, really briefly with you. This is really a win-win-win. The patient wins because of faster, easier access to care by going to your community pharmacy for services. The doctor wins because he's still managing the care plan for the patient and is getting compensated for that. And in fact, these visits will improve his quality measurement or her quality measurement scores to be able to get higher reimbursements for the services they do perform. So you're filling care gaps that are missed by being in the IPPN, Independent Pharmacy Provider Network. But the biggest winner, even though the patient wins by having easier access, the doctor wins because he's still managing the care plan. The pharmacy wins the biggest in this solution because approximately 67% of all the bill charges stay with the pharmacy, okay? Because you're the place of service. So things that you're already doing, like immunizations, you turn a $20 or $40 immunization reimbursement into an $85 preventative health visit, or continuous glucose monitoring. Today pharmacists are already just providing free consultation to the patients to help them set up their glucose monitors. When you're in the IPPN network, you can get compensated for that. You get paid anywhere between $50 to $150 per patient per month for doing continuous glucose monitoring. So many other things, weight loss counseling, smoking cessation. There's so many different programs. Here are just some examples of the CPT codes. All of the 99391 through 99397 are all the preventative health codes. You have your office codes, etc. The last thing that I want to share with you is after getting into network with IPPN, If you have room for it, you can do a full brick and mortar clinical room. Okay. The benefits of doing a brick and mortar clinical room is that it's HIPAA compliant, so you can even expand your scope of services even further. Now, this isn't for every pharmacy. You've got to have space for it. You've got to be able to have a footprint of about a 10 by 12 square foot area. Most states require that you have to have a hand washing station in the clinic, so you might have to bring some plumbing in to have that hand washing station. But it is owned by the pharmacy, but managed by BRIM. You even name it. BRIM is just the intel inside. So you name the clinic, your pharmacy's name and wellness, but it'll be powered by BRIM. It's a three-legged stool. The first leg of the stool is the build out of your clinic and the managed services. The second leg of the stool is the talent exchange. Imagine Uber, but for medical staff. So there's no reason to have a nurse or a nurse practitioner on staff if you don't need them. So you post the shift that you need filled, and then a medical provider fills that shift for you. And then the third leg of the stool is what I'm most excited about. That is the financial vehicle. So it's the pharmacy fund that helps you build out your clinic. And then when you pay back the fund, you become a cooperative member of the fund. So not only are you helping the next community pharmacy build up their clinic, but you're earning interest on that money in the fund. So it can be part of your future retirement when you're ready to hand your pharmacy down to the next generation of community pharmacists. So I do appreciate everybody taking time to learn about all the clinical services that are available. There's never been a more exciting time for community pharmacies. We've had a lot of bleak years of PBMs taking all of your profit, DIR fees and clawbacks that have put community pharmacies under water. And now is the time to really shine and take advantage of all these clinical opportunities for you to expand your scope of services and serve patients in a way that you've never been able to serve them before. So thank you very much for joining us this afternoon. It's been my pleasure to share this information. Do appreciate you taking time out of your busy schedule. And please get with the care consultant that invited you here this afternoon to get your paperwork filled out so that you can get onboarded for the remote therapeutic monitoring. If you want more information about BRIM or IPPN, don't hesitate to reach out to me. I'm happy to help you get set up with additional demonstrations on those programs as well. So that's been our program this afternoon. Thanks again for joining us.